So, let's talk about Apixaban. You've probably heard the name. It's one of the most common prescriptions out there. But what's really fascinating is what's happening on a molecular level. It's like this quiet guardian for millions of people, and today we're going to pull back the curtain and see exactly how it works. And that's really the big question, isn't it? How can this one little pill prevent something so catastrophic? This isn't about brute force. It's all about surgical precision. So let's dive in. Okay, so before we can really appreciate the solution, we have to understand the problem. I mean, our bodies are actually designed to form clots, right? You get a cut, you want it to stop bleeding. But sometimes that amazing system goes haywire and starts creating these dangerous blockages where they absolutely should not be. And the threat is really serious. A dangerous clot isn't just one thing. If it forms in the deep veins of your legs, that's a DVT. If a piece of that clot breaks off and travels to your lungs, it can become a fatal pulmonary embolism. And for folks with an irregular heartbeat, something called atrial fibrillation, or AFib, a clot can form right in the heart, travel to the brain, and cause a totally devastating stroke. So, how do you fight something like that? Well, the older medications were kind of like using a sledgehammer to crack a nut. But modern drugs, like Apixaban, they're much more like a scalpel. They're designed for one very, very specific job. And this right here is maybe the most important thing to get. Apixaban doesn't go in and destroy clots that are already there. That's a different kind of drug entirely. Its whole purpose is to be a shield. It's there to stop the biological chain reaction that lets those dangerous clots form in the first place. It's all about prevention. To really get this, you have to picture a line of dominoes. This is what's called the clotting cascade. It starts with some kind of signal which tips over the first domino. That activates a crucial protein called factor XA. That's our second domino. Factor XA then knocks over the next one, which produces something called thrombin. And thrombin's job is to create this sticky web of fibrin mesh, which is the final solid clot. It's a perfect chain reaction.
So, where does Apixaban come in? It does something incredibly clever. It goes right for that critical second domino, factor XA. It directly targets and blocks it. It's like it just reaches in and plucks that one specific domino right out of the line. And just like that, the cascade stops, dead in its tracks. No thrombin, no fibrin web, no clot. It's just so precise.
Okay, that's the science. It's cool, right? But what does this molecular shield actually mean for people? Let's look at who it's protecting every single day. There are really four main situations where Apixaban is a go-to choice. We're talking long-term stroke prevention in AFib, short-term protection right after major surgery, and also treating and preventing clots like DVT and PE from ever coming back. So picture the patient with AFib. Because their heart isn't beating in a nice, steady rhythm, blood can kind of pool in the corners of the upper chambers, and stagnant blood loves to form clots. So Apixaban is taken every single day to constantly keep that clotting cascade suppressed, which dramatically lowers the risk that one of those clots will form, break off, and travel up to the brain. And then you've got this other huge use, short-term protection. After a big operation, like a hip or a knee replacement, a patient's body is on high alert and they're not moving around much. That's a perfect storm for developing a DVT in the legs. So Apixaban is often used for just a few weeks as a temporary shield to get them through that high-risk recovery period safely. Okay, let's switch gears. If you're the one actually taking this pill, what are the practical things you really need to know? Because understanding how it works in your body is absolutely key to using it safely.
First off, why twice a day? Well, it all comes down to something called half-life. It takes about 12 hours for your body to process and clear out about half of the drug. So by taking a dose every 12 hours, you make sure you always have a steady, consistent level of that protective shield working around the clock. And here are the big takeaways for daily use. One of the great things is that you can take it with or without food. It doesn't really matter. Your specific dose is carefully tailored just for you, based on your age, weight, and how well your kidneys are working. And if you miss a dose, the rule is simple. Take it as soon as you remember. But, and this is critical, never ever take a double dose to try and catch up. But look, anytime you're talking about a medicine designed to stop your blood from clotting, there's a big, obvious question hanging in the air. And yep, the answer is bleeding. By its very design, the drug is lowering your body's ability to form clots, which is great for preventing a stroke, but not so great if you get a bad cut or have an internal injury. It's the unavoidable trade-off for this kind of protection. But This is exactly where Apixaban and its whole class of drugs, called DOACs, are such a massive leap forward in medicine. It's a total game changer, both for convenience and for safety.
Just look at the comparison to the old-school standard warfarin. With warfarin, you need constant, annoying blood tests to check your levels. You have to be super careful about what you eat, especially green leafy vegetables with vitamin K. With Apixaban, none of that. No routine monitoring, no major food interactions. But here's the biggest deal of all. The risk of the most feared side effect, a bleed in the brain, is significantly lower. I mean, that's not just an improvement, that's a whole new level of safety.
So that brings us to the ultimate safety question. If the main risk is bleeding, what happens if a patient gets into a serious car accident or needs emergency surgery? Can you turn the shield off?
For a while with these newer drugs, the answer was, well, not really. But now, the answer is a resounding yes. There is a specific reversal agent, an antidote that was designed for this exact purpose.
And how this works is it's so clever. Remember how Apixaban works by hunting down and blocking factor XA? Well, this antidote, andexanet alpha, is basically a fake factor X. It's a molecular decoy. It's been modified so it can't actually do anything to help with clotting. So when a doctor infuses it, all the Apixaban molecules in the blood get tricked. They immediately grab onto these decoys, which frees up all the real factor XA to get back to work and restart the clotting cascade. It's brilliant.
So when you think about it, Apixaban isn't just a pill. It's an entire system. You have this incredibly targeted shield to prevent clots, and you have a specific key, the antidote, to turn that shield off in an emergency. This shift toward highly specific, intelligent drugs that we can actually control is changing everything. And it really makes you wonder, what's coming next?